Hello and welcome to the Society with Fatma Shaheen at PTV World. Today on our show, we'll be talking about the year 2022 in review. More particularly, we'll be giving you an overview of the various social developments as they did happen in this very year. We'll be talking about the social and of course the psychological impact of the unprecedented floods that Pakistan did witness in the year 2022. We'll also be talking about the various laws and policies which were passed in this year so as to empower Pakistani women, and of course in this regard we'll also be talking about the phenomenal appointment of Honorable Justice Aisha Malik Sahiba to the Supreme Court of Pakistan, that too in a first. We'll also be talking about how various trends, be it in the beauty or be it in the fashion industry, they have evolved over a period of time, and we'll also be talking about the changes that we do see in the education and of course in the healthcare system too, and what more is it that we need to do to improve of course both the respective systems. This and much more to follow on today's show, that too with a very diverse panel. Let me introduce you to my today's panel. My first panelist for the show today is Dr. Madiha Azmat Rao, who is a consultant dermatologist alongside being an analyst. Assalamu alaikum ji and welcome to the show.
Thank you.
You're most welcome. My second panelist for the show today is Hassan Ahmed Mia Saab, who's a visiting lecturer and an educationist. Assalamu alaikum sir and welcome to the show.
Thank you.
You're most welcome. My third panelist for the show today is Miss Alia Khan, who's a legal expert. She's also a social activist. Assalamu alaikum ji and welcome to the show.
Thank you.
You're most welcome. And via Zoom, we'll be joined by Dr. Sardar Muhammad Shoaib Khan Saab, who's a consultant of medicine. Assalamu alaikum sir and welcome to the show.
Walaikum assalam. Thank you very much for inviting me.
You're most welcome, sir. In this regard, we must of course, start our conversation with, the unprecedented floods which did happen in Pakistan. In this regard, it's very important to talk about, of course, the health catastrophe which we did witness because of these floods. So as a medical healthcare professional, how would you evaluate our healthcare system's responsiveness and of course effectiveness in fighting off the same?
Assalamu alaikum to you and all your listeners. Thank you for inviting me. I think I agree with you. These floods were historic, and it involved massive areas of Pakistan. 33% of Pakistan was submerged, and a very large number of people had to be moved from where they used to live before. What was different about these floods was that they affected the most vulnerable societies, vulnerable parts of our societies, the poorest people living in villages, those who had little health awareness, those who had little in terms of economic resources, health resources, education. And again, health-wise, we saw that the most vulnerable, the women and the children, were the most affected. Now, in dealing with it, there are some positives and there are some negatives.
Right.
We saw that there was a big mobilization that happened in the government level, at societal level. From all over Pakistan, people came came and helped these areas. But again, there was some lacking. The disaster preparedness wasn't there. The effort was lacking coordination.
Right,
Sometimes
sir.
people
Sir,
didn't
but
know
before going on to those issues, I think I would want you to talk about the disease aspect first. When we talk about various diseases, we've seen that, waterborne diseases, we've seen infectious diseases, we've seen so many other kinds of diseases being on a surging high. So how successful do you feel has Pakistan's healthcare system been in tackling with all these diseases?
These diseases attacked the people in waves. So first wave was the one that was caused by the initial flood, the infectious disease, the malaria, the gastroenteritis, the diarrheas. But then after that, there was the diseases that, that came with the displacement and the living, there was unhygienic living. Then there were waterborne diseases. And then after that, the malaria, the dengue, even COVID attacked many of these areas. And then after that, we also saw that there were people who were already affected by diabetes, hypertension, chronic long-term illnesses. They got worse. And then we saw the long-term effect of floods, the mental health aspect, the fact that these people were traumatized. And, the women, there were women who were pregnant. There are still thousands of people.
That's very rightly put by yourself, but on this I'll take you on board as well, Dr. Saib. I think you would have your own narrative to add on this. As a doctor yourself, how long do you feel will it take us, for us, as a nation, as a society, to come out of this?
Definitely the mental diseases, the psychological factor will take a long time to get cured. Otherwise, what we saw earlier I was talking about, there were dog bites, there were insect bites, snake bites, there were so many things, bacterial, fungal and viral diseases which were seen among people living together. We saw a lot of scabies which we couldn't help it because of the unhygienic conditions.
And so many
in
skin
which-
diseases. I
Yes.
think as a dermatologist,
Yeah.
you would agree with me on this. And these
Yes.
were those diseases, Doc Saiba, which were unfortunately not even diagnosed a lot of
Yes,
times.
and they were transferable. If one was suffering from them, the whole family suffered from it as
Right.
well. Yeah.
More particularly, I was seeing that there was this a very surging high being recorded in newborn babies, basically. So I think this is something that will unfortunately continue for some time. And I think with the onset of winters, more diseases are expected
Yes,
to rise. that
pneumonia
way.
as such, like people are living under open air, they don't have places to go, they don't have blankets, they don't have like proper care. So people are suffering from chest infections. Pneumonia is one of them, which can lead to death and other serious problems.
But sir, coming towards you, Hassan Sahab, I think we must of course also talk about the impact that floods did have on the education system of the country. So in this regard, when it comes to of course taking the children back, sending them back to schools rather, what are the challenges you feel as an educationist is it that we face, other than of course having not the right infrastructure in place? But how long do you feel will this journey be?
Journey is going to be long as long as they don't get all of the other infrastructures in place and people start to go back to their houses. Till now, they would have been put into temporary solutions like camps, but the kids need their education. That should not be stopped. Why? Because they need their mind off of such a tragic incident, and the parents need a time off as well so that they can figure out how to establish their economic means, which have been lost.
I think this is something that we need to work on. Although, having said that, I think we must also, of course, mention the fact that we have seen in Sindh particularly that, different schools have been set up even in the relief camp area so as to ensure that, people, children particularly, they get that right to education, even if it is at a very basic and, temporary level. Coming towards you, Ali, I think we must also, of course, talk about, the legal perspective. When we talk about 2022, we have seen that, there have been laws which have been passed in this very year. So when we talk about, the harassment at workplace laws, I think which were, of course, very progressive, very women-centric, survivor-centric at the end of the day.
Yes.
Why do you feel are these laws so important, more particularly, when it comes to protecting women?
So I think harassment and especially harassment at the workplace, even at public places actually, has turned into a pandemic in itself. And I think it's important to bring in laws that can protect women as well as prevent the incidents of harassment. So in 2022, there have been amendments to the harassment legislation for the ICT as well as for Punjab.
Right.
The one passed by the National Assembly is wider in ambit. It covers a larger number of workplaces, it covers a larger number of employees, employers, and more importantly, it also includes gender-based discrimination within the definition of harassment. Punjab is yet to follow in some of these amendments, but overall, they've been very progressive amendments made by Punjab Assembly as well.
Right. And I think the best thing now is that the way the harassment has been defined as per the law, that has been widened. Now it's not necessary that only a women complainant can come forward.
That's right.
A man or a transgender, they can also be, complain of being
Absolutely.
harassed.
And I think another very important subset is home-based workers as
Right.
well as domestic workers. They have also been included within the ambit of the Act. And then virtual businesses, home-based workers in terms of those people who are working from home, especially after the COVID-19 pandemic. All of those subsets of the population have also been included.
And these
within
were the
Act.
categories which were not very particularly previously included. I think that's
Absolutely,
something
it was
which
very
needs to be
limited in
clarified.
nature.
Right.
It didn't even cover students, which again is another very progressive inclusion in the Act. Enforcement mechanisms under the Harassment Act are also very much in place. So the ombudsperson who sits in Islamabad. There's a very, it's a very vibrant office, receives lots of complaints, resolves them in a timely manner. And then in the public sector as well, we've seen a greater number of public offices that have inquiry committees constituted under the Act. So I think overall the situation is looking better than it used to. Definitely much better than we started off with in 2010.
Dr. Saib, I think in this regard, we must also, of course, talk about, how the COVID-19 pandemic that impacted the fashion and, of course, the beauty industry of the country. Because I remember there was this time when everybody was staying in, during the lockdown, and they were very focused on how they used to look, basically getting more and more of such treatments. So now, considering again that we are, moving past that, danger zone, as Dr. Saab very rightly put, how then do you feel, will the fashion and beauty trends be changing? Will we still be sticking, with all these cosmetic aesthetic treatments, or, you feel that we'll get out of them?
So we saw a boom during the pandemic because everybody was on Zoom. We were talking to one another through our computers and telephones. So we were very focused about our faces and all. And now we are moving out. So we are looking after ourselves, our bodies and our figures. Definitely this industry is going to survive, and it is picking up.
But I think the reasons then would change, Dr. Saiba, because then the reasons were different, because you were sitting at home, you had to look good, you had to participate in all the meetings, which is why which was a reason because of which you actually sought treatments, aesthetic treatments, so to speak. But moving on, when we talk about analyzing the yeas and the nays of what has been in and what has been out in the year 2022 when it comes to seeking cosmetic aesthetic treatments, what would your views be on this? Like, what have been the stand of most popular treatments, and what were those which were comparatively less sought after?
So the face was in focus during the pandemic. The double chins were out. People were taking treatments for the double chins and the neck and the faces. And now we are focusing towards the body. We are going towards more healthier aspects. We are taking treatments to look good generally, physically. We try to look better, but there were certain things which were overdone, like we were seeing overdone lips, overdone cheeks, bloated faces. Now we are going towards more natural versions. We saw Russian lips, we saw those cat eyes, those bloated cheeks. Now that is out.
Right.
We are moving
I think the
towards,
focus is now on looking like yourself, which is of course something very positive. And I also see that this trend of people actually opting for body sculpting treatments, that has also really picked up.
Yes, these treatments plus people are moving towards more healthier lifestyles. They're going to gyms, they have started exercising, they're looking after their diets, and which is very good in a way, because once out of the pandemic, so we are looking after ourselves, which is really good. I've seen a shift of people which were very idle, staying at home. Now they have started moving, now they have started going out. So
coming to you, Hassan Saab, I think we must also of course talk about the choice of subjects which is being offered to students, more particularly in schools. So considering of course that you've taught students for such a long time, do you feel that this trend of universities offering different kinds of diverse subjects, that is something that we see in the school system as well?
It should be introduced. It's all about the careers that the kids would be falling into after they end their high school education and they go into their undergrads and their graduations. The thing is that it should be designed in a manner in which the kids are given the opportunities of variety of subjects starting from middle school. And so that they get educated and they get apt at all of those fundamental knowledge, and then they can pursue that particular line. Otherwise, right now we are only focusing on very few professions.
So this is the change you would want to see as an educationist in the system?
Definitely, definitely, because in the whole wide world you would see that there are many industries that we haven't tapped into in our schools. There's forensics, there's graphic designing, there's TV and film production. There are a plethora of subjects that can be offered, and that can be for the grooming of their own individual appearances or to teach them various skills. So basically the point is that skill-based learning should be made a priority,
Right.
rather than.
But in this regard, I think we must also, of course, mention the fact that, you know, teaching of the Holy Quran, that has been made mandatory, more particularly in the province of Punjab. So how do you see that? Because, of course, you know, this is something very good. Of course, this is something which will teach children the very basic principles of our religion, that too at a very young age. But in practice, how do you see this being implemented? Do we have like enough trained teachers to do the same?
Hopefully this thing does continue, which is a great initiative. Why? Because the kids, in fact all of us, we should be educated in those fundamental things, because they cover those surahs of the Quran in which all those basic teachings about our iman and other factors are included. So it's good that the kids now stick to the fundamentals and they learn about them, and they build a good foundation. Yes, there are a lot of well qualified teachers, because that was a gap which we were seeing before,
Right.
that the students or the people studying in madrasas, there was a gap between the conventional studies and the Islamic studies. So now you can bridge that gap
Of course.
and procure those people, hire those people to teach the kids from the conventional side, because we should bridge the gap.
Right, sir, your point is noted, on which I'll come to you, Alia. I think in this regard, we must also, of course, talk about, you know, the very pressing issue of gender-based violence, that too particularly against women. Now, according to the findings of this report of Sustainable Social Development Organization, this report very clearly suggests that, you know, the maximum number of cases of violence against women, those were reported in Punjab, after which Sindh was the second, and then the federal capital, which is Islamabad, was on a third. So, you know, as of course a lawyer and as a social activist too, what measures do you feel have been taken, that too for the betterment of, you know, of course, addressing all these gender-based violence crimes in the year 2022, and what more is it that needs to be done?
So, since the passing of the Punjab Protection of Women Against Violence Act of 2016, Government of Punjab has taken multiple measures, institutional as well as policy measures, to prevent instances of violence, increase reporting of cases of violence, and make sure that all protection mechanisms are aligned with one another. Most recently, actually, I'll go back to what happened in 2016 first.
Right.
The first Violence Against Women Center was inaugurated in Multan under the auspices of the Women Protection Authority, and this center provided a one-stop shop for all services that survivors of violence would need, including a shelter, a medical legal service, legal aid, as well as the services of a magistrate. And the center has actually been very successful over the last four plus years.
Right.
But most recently, the Punjab Violence Against Women Act has been notified in all districts of Punjab,
Right.
which basically means that the same protection mechanisms which were limited to Multan will now be present and available to women across Punjab.
Right.
I think in itself, this measure will require, of course, a lot of human resource shifts, a lot of budgetary allocations, but thankfully no more institutional mechanisms, since every district in Punjab already has shelter homes for women, some skill development opportunities for women, the provision of legal aid through the human rights centers for women. So overall, I feel like the protection mechanism is increasing
Right.
in Punjab for the benefit of women far and wide. And it shows itself in increased reporting of cases
course.
of violence.
Right.
So Punjab being the most populous province in Pakistan.
And being that province in which, of course, the maximum number of cases have been reported. In this regard, I think it's also very important to talk about the fact that, you know, the government in a first has also launched the first Pakistan's transgender, you know, anti-harassment hotline, so to speak, which of course has the same function to address, you know, all these harassment complaints of transgenders too. So I think it's very good that we talk about, when we talk about women, we also talk about, you know, other marginalized sections of the
Absolutely.
Pakistani
The
society.
Ministry of Human Rights has been very proactive in creating legislation for transgender persons, a hotline, various services. There have been collaborations with civil society organizations for the betterment of this very vulnerable group. So again, we're on the right path.
Right.
There's no amount of measures which may be absolutely enough, but the government is definitely doing a lot.
You wanted to add something to this?
I want to second what Alia said, that there are no number of preventions that you can completely 100% take.
Right.
But you can minimize it by educating the children from an early age, both young boys and young girls,
Right.
about what harassment is, about what bullying, harassment, and what etiquettes are, and what the morals and the values should be in our society. So that can very much affect and change the way they are brought up, and then they grow up to be responsible citizens of the society.
Of course, and I think that's very important because we've generally also seen this shift in education, whereas of course there was this one time where education was very strictly considered to be formal education, that was, you know, what you were taught within the four corners of a classroom. Now it's more open, it's all encompassing, because, you know, education then becomes non-formal too. It's a lot of things that you pick up from your surroundings, from the media, from parents.
Everyone has to be educated, and education is supposed to be now understood that it is not only learning ABC and 1, 2, 3
Of
and
course.
Alif, Be, Pe, but it is more about shaur and how well you can understand what is right and what is wrong, and inculcating it from an early age, so that they grow up to be those people who advocate such issues and they take a stand against such oppression in the society.
Right, on which I'll come to you, Dr. Shoaib. I think in this regard, we must also, of course, talk about, you know, this increase in the HIV cases that we have seen in Pakistan, particularly in Islamabad. So, as a healthcare professional, what reasons do you attribute to the same, and what are the preventive measures that we need to take? Because this is also, of course, that one disease which has a lot of social stigma attached to it.
Yes, I mean, this is one of the unfortunate developments of another unfortunate development of year 2022, that we saw a rise in the cases of HIV. Now, this is because of a couple of reasons. Firstly, you know, we saw that the awareness around HIV has increased, and people are knowing that this is a disease that they need to get checked for, and they're going and getting tested. But obviously there was this COVID pandemic, and it also affected us in many ways, and HIV increase was another one of them. We saw that there are some communities that are being affected more than others. These were transgender people, and people who were using drug abuse, and majority of these cases are these people who are listening about this disease and going to these HIV centers and getting tested, and then they become positive, rather than, you know, we as health professional finding out this disease in the community. And obviously, I think this is probably a tip of the iceberg. You know, what is positive are only those cases that have come and got tested, and maybe there is a large number of people who haven't yet been tested, which means that, you know, we as health community and as government and as society need to think about this. The stigma has decreased, but I wouldn't say that it's completely gone away. There are still, you know, people who, as soon as they've been told that, you know, you're HIV positive, they will, you know, go away from the hospital and stop coming to the doctors. And, you know, there are actually a lot of health professionals as well that, you know, have a lot of fear of this disease, and they actually fear the patient, and they will stop seeing a patient when they see a patient who's HIV positive.
Right.
So actually there is a lot of work to be done, and I must appreciate you in this regard that you asked this question in this program, because this is where we can spread more awareness in our
course.
communities, in our people about HIV, that, you know, this is not the disease that used to be 15, 20 years ago. There's treatment
And so
available.
now there are so many modern treatments available for it.
You know, in Islamabad, there is a HIV center. You know, if a patient is diagnosed as HIV, they will be offered free treatment. They will be offering free follow-up service, free medicine. And, you know, if these people, you know, vast majority of these people, if they take these medicines, if they get regular tests, regular checkup, they can lead a healthy life.
Right.
So, you know, these things need to be told to our people.
Right, on which I'll come to you, Dr. Saib. I think in this regard, we must also, of course, talk about, you know, the various ever-evolving and, of course, very dynamic kind of fashion beauty trends that we have observed in the Pakistani society, more particularly in the year 2022. So when we talk about, you know, Pakistan's obsession with being fair-skinned, how do you, as, of course, you know, a cosmetic aesthetic, you know, consultant, see that changing over a period of time? Because, you know, if you were to see this objectively, I at least feel that that obsession with, you know, having a fair skin, that is kind of diminished over a period of time.
So Pakistan was a nation, we used to be obsessed with fairness. We always thought that it is the way to being successful, being beautiful, which it is not.
Of course.
Nowadays people are more aware, people are more educated, and they know that these kind of creams, these kind of products, they contain very hazardous ingredients in it. There are certain metals like mercury, lead and iron which can be poisonous to the person who is taking it and who is putting it on their cells, which can mishandle your digestive system, reproductive system, your brain cells, your skin, and it can be carcinogenic as well.
And I think the worst impact that it does have is on you as a person. The way it hits on your self-esteem, the psychological impact,
the mental health,
the
also
mental health
suffers.
aspect of it, because a lot of times people just equate themselves with being beautiful just because they are fair. Is this something which is rampant with men as well? Because I feel the obsession somewhere. That is also true with men, might be more with of course women, because that's how we kind of place them. But what about men?
I think it does prevail in some part of this strata, but I think more awareness can be the solution.
Right.
To educating men that fair color is not the end all and be all of life. It is about their personality, their character, their values, which they carry themselves with.
And we have even seen, big brands basically change the name of their creams so as to not be very, focused on, of course, promoting fair skin, so to speak. But moving on, I think in this regard, we must also, of course, talk about, generally rural education as well. So when we talk about rural education, what are the suggestions that you would want to make in this regard so as to not only improve the quality of education that is being imparted in the rural areas of the country, but also to improve people's, rather children's access to it?
I would say that the curriculum should be developed, which has been in play for quite a long time, and it's about time that it does happen that Pakistan has its own curriculum. Even provinces can have it, but it is time that we build the foundation in the children, which is more closer to our culture and our identity, so that they don't enter the world into in a flux in which they can't identify themselves as being Western or as being Eastern.
Right. So basically these are the things you feel we need to focus on. And also I think in this regard, when it comes to rural education, of course, prioritizing girls' education here, because these are the places where unfortunately the barriers to the girls' education, they are the highest.
They are, and not only in rural areas but everywhere this awareness should be created that women and the girls should be educated. Why? Because they are the ones who are going to bring up the whole house. They are going to bring up the children who will become the next leaders.
Like they say, you educate a man, you only educate a man, but when you educate a woman, you educate an entire generation, of course. Please
add to that as well, as somebody who's been working on social issues, especially violence against women, for a while now. Education is absolutely crucial for women and girls as much as it is for men and boys.
Right.
In my line of work, we've been seeing for years, we've been seeing education as the prime problem, which it contributes to the incidence of violence, it contributes towards lack of awareness. But what it also does is give women fewer means of livelihood.
Right.
So in order for a woman to truly protect herself, to truly make sure that she is not faced and stuck in a violent situation, she must be educated.
Of course. Yeah.
This is not limited just to academic education. I'm talking about skills development. I'm talking about vocational training.
Very right.
That does increase women's chances to fight back, to have a way out, and to make sure that they aren't dependent on an institution of the state or on a other family members who may or may not be
and of course this
towards
also
them.
gives them the option to actually move away from
Yes,
being
to
abused
not
at
be
the end of the
stuck
day,
in
to
violent
not be
homes.
stuck in abusive
Yes,
marriages or any kind of
absolutely.
abusive relationship, so to speak. Right, Alia, your point is noted. On which I'll come to you, Dr. Shoaib. I think in this regard we must also of course talk about diabetes, and we have seen that in the year 2022 that has also been unfortunately on a surging high in Pakistan. According to reports, 1 in every 4 people in Pakistan is suffering from diabetes. So of course, as a specialist in this very disease, what reasons do you attribute to the same, and why do you feel that when it comes to, of course, controlling diabetes, prevention is better than cure?
So thank you for asking this really important question. 2022 saw Pakistan overtake USA in terms of number of people with type 2 diabetes. And just a little comparison, in 2021 alone, according to International Diabetes Federation, 6.7 million people died because of diabetes. And until today, due to COVID-19, the total number of deaths is still 6.6 million. So diabetes is a slow pandemic, but it is a massive pandemic, and it is a massive health cost for societies. And Pakistan is especially vulnerable to diabetes because of our genetics. And we have a very rapidly increasing trend of obesity, childhood obesity, adult obesity, and as we all know, obesity is the root cause of diabetes, like many other causes, many other diseases. And the reason why we are becoming obese as a nation is because we are more sedentary, we're not on our feet as much as before, and we are eating very high calorie diet all the time. And as the calorie intake is high and calorie use is low, all of that get stored in our body as fat.
Right, sir, your point is noted, on which I'll come to you, Dr. Madhiya. Moving towards the end of the show, I think in this regard, we must also talk about, what are the, of course, most imminent, rather the most trendy kind of trends that are expected to be there when it comes to the year 2023. So in this regard, what would your, viewpoint be, more particularly when it comes to people seeking various kind of cosmetic aesthetic treatments?
So we would be seeing very subtle changes, more natural looking faces, and people should be looking like themselves rather than looking like some other celebrity. And I always believe it's better to look a bit older than to look weird.
So basically, I think the focus then should be of year 2023 to look like yourself.
A better version.
A better version of yourself. So basically then to enhance your natural beauty.
Yes.
On which I'll come to you, Hassan Saab. And of course, before we conclude today's show, I think in this regard, we must also talk about, the reform which is much needed when it comes to, of course, improving both the quality as well as the standard of education in the country. So as an educationist yourself, what would your proposals be, that what are the things that we need to actively work on in the year 2023 in this regard?
Well, a major planning should be at a strategic level. A strategy should be made that what our vision should be for the next 20 to 30 years.
Right.
We can specify certain professions and certain industries so that we start to build those, build the education of the children in those particular fields, so that we have such a big population of skilled workers who would then go and achieve in those particular areas, and then introducing variety of subjects that the students can choose from since their middle school, and then they can develop on them in their advanced level years, and then further in the universities as well. So the system should be laid down in such a way that the kids can stay on that particular track and achieve a certain and be really good at the profession that they choose. And we have multiple varieties of professions available for them, which they can then be employed into as well.
Of course.
So it's a whole system which has to be
I think that gap that needs to basically end, the gap between when you graduate to when, of course, you get a job. And I think this is something which you were earlier pinpointing towards too. But coming to you, Ali, I think in this regard, we've also seen the fact that, Pakistan in its first basically appointed its first female Supreme Court judge, Honorable Justice Aisha Malik Sahiba, which of course is a very big milestone for our country. So at the end of the day, being a lawyer, being a woman yourself, how important do you feel is this an achievement when it comes to, ensuring women empowerment in the true sense?
So I think her appointment as the first Supreme Court judge of Pakistan has been monumental. It's going to, we'll keep seeing its effects for years. But what it more importantly signifies is women's inclusion and how important that is in the justice system. Having been working in the system for a while now, I've seen the effects of having more women in law enforcement, more female judges, more women workforce in government departments that are working in the grassroots. And as a society as well, women have proven to respond better to women.
Of course.
So that is, I think, where the root lies of how women, greater women in the workforce could benefit women at large in Pakistan.
Right. So I think at the end of the day, this is something which will not only, of course, give our, judicial decision making more of a
Yes.
gender inclusive angle, it will also be, for the betterment of the society.
Yes,
so
and
to
Justice
speak.
Aisha Malik has been responsible for a lot of landmark judgments in the past. The most recent one was the removal of the two-finger test in rape trials.
Right.
And she's also had, inaugurated as well as organized women judges conferences for
Right.
in the last couple of
She
years.
has been a very strong
So
advocate for women's
she's
rights.
been instrumental in reshaping narratives, in reshaping the legal community, composition of men and women in the judiciary. But back to your question, I think the importance of awareness is also one that must not be underemphasized.
Right.
There's no amount of money that can be spent on awareness campaigns that will ever be enough for a country like Pakistan,
Right.
especially if we're aiming to see long-term grassroots level changes in our
Progress, of
society, in the status of women across the country.
Overall, generally, you would want to
Yes,
say. Right, Alia,
absolutely.
your point is noted. On which I'll come to you, Dr. Shoaib. I think in this regard, before we conclude today's show, it's very important for us to also talk about, the much needed reform that, of course, should be there when we talk about, improving the quality and, of course, the standard of Pakistan's healthcare delivery system. So in this regard, what would your proposals be that, how can doctors like yourself aspire not only to give a better service to the patients, but also in this regard, kind of help them improve their access to the healthcare system too?
I think that is really important. I would say that there should be continuous training programs for doctors, for nurses, for paramedics. There should be continuous professional development, which should be monitored. The role of the legislators and the role of the regulators comes in here. The Pakistan Medical Council, the nursing councils. They need to make sure that our nurses and doctors are up to date with the new challenges of medicine. And they are continuously getting updated on that, and that will equip us with the knowledge that we can then use to treat our patients.
Right, sir, your point is noted. On which note I would like to conclude today's show. Thank you so much, Dr. Madiha. Thank you so much, Hassan Saab. Thank you so much, Ms. Alia. And thank you so much, Dr. Shoaib, for choosing to be a part of our show.
Thank you for inviting me.
Well, to conclude today's show, we generally spoke about, the ever-evolving and, of course, the changing trends in the various sectors in Pakistan, be it the beauty or the fashion industry. We also spoke about the change that has happened in the education system. And in this regard, we also spoke about the changes which did come across when it comes to the healthcare system, or even for that matter, the laws and policies of the country. In this regard, whereas, of course, there's no denying to the fact that, unfortunately, the floods have had, a negative impact on us as a society, taking a heavy toll on our psychological health, amongst other things. What must not be forgotten is that they've also given us a chance to actually focus more on, of course, being a more climate resilient nation. On that note, signing off for today. Until next time, take care and Allah Hafiz.